Let's get started, right? Let's start with our opening. We're really excited to have Natalie Cooper here. She is the president and CEO of Wellpoint Tennessee, where they ensure 540,000 members receive access to quality care and support services. She leads all of those efforts operationally and has a lot of experience in the healthcare arena. She also has served on active duty and reserve command with the United States Air Force and has played roles in the Department of Defense. Please help me in welcoming Natalie Cooper to our conversation today.
A little shorter here. Good morning to everyone. Thank you for that warm introduction and for the opportunity to speak to you all this morning. So this morning, I am standing before a number of collaborators. When I think about advocates, when I think about leaders, when I think about change makers in Tennessee, we are all here in this room. And we are the ones who are making up Tennessee's landscape when it comes to healthcare. So this morning is truly an honor. I'm here with a deep appreciation this morning of the work that you all do in this space. It contributes daily to the well-being of our Tennesseans and those who we want to make an impact to here in the state of Tennessee. It is a shared journey, and I definitely believe it is one that we can do together. So this morning, before we really kick off the entire conference, I wanted to have an opportunity to really level set and focus on a vision that can bring us closer together when we think about the whole health of those here in Tennessee. We all know that there are going to be obstacles in front of us along this path, and there's no challenge that we can't do together. But if we approach it as partners and allies and collaborators and those that we trust within one another, we can create a stronger system here in Tennessee. So this system is grounded in 3 key principles: trust, access, and collaboration. So when you think about those 3 words, it's something that you can probably align to each and every day in your work. Now, we all come from different backgrounds and have different experiences, but the value of this conference today is the diversity that we will bring to each table that we have the opportunity to sit in. We will be able to strip away our labels and really focus on the common ground of improving the health of those in Tennessee. We see that we are united by a shared goal: the health and wellness of every person in Tennessee. As discussed when I came up here, you may not hear about a lot of federal health initiatives, but we can do a lot to change the health and wellness here in Tennessee. So when we focus on the whole health of the member, what does that mean? That first means we acknowledge that just going to a doctor's appointment does not mean a person is healthy. We understand that there are barriers before they can even make that doctor's appointment. That's when we start to discuss the social drivers of health. Then we start to think about the trust. There are a lot of opportunities that we have in Tennessee, and we have to come to the realization that a lot of members and patients don't trust us, so they're not even taking advantage of the things that we're putting in place. This could be more providers who are focused on quality. This could be collaborators in this space that can help drive their outcomes. But if they don't see us and if they don't trust us, they're not going to take advantage of those opportunities. So when we think about some of the things that impact us, we think about access to nutritional food. We think about safe and affordable housing. We also think about the essential transportation for services, ensuring someone is able to get to their medication, or someone is able to get to access the food that they need to live a healthier life. So this morning, on behalf of Wellpoint, I'm so excited to be here to talk about our trusted network, what we are doing to really deliver and drive the outcomes of those in Tennessee. And it starts here in this room. As you go to different breakout sessions today, challenge one another. Have the question about whole health and what that means to you. You're going to hear from a lot of great speakers. You're going to sit at the tables with great collaborators who can help you drive your outcomes forward. But do you know what you want to focus on? Strategy without execution is still just strategy. So how are we truly coming together to work to execute a plan? When we think about the impact and purpose that we have in this room, we can definitely do things differently, and we can do things better. So how are you challenging yourself or your organization to give more, to ensure that members and providers and people in the community not only know of what you bring to the table, but they're committed to driving things forward with you? To have amazing providers who are focused on quality, or programs that ensure that we solve for food instability, but members who won't take advantage of it are still programs. So when we think about how we can move and lead in a different capacity, I want you to think of two things. Everyone in this room, no matter how you align or what views you see, everyone wakes up with the same two things every day: a choice and a chance. So the choice that you make every morning when you get your chance to make an impact, that's your decision. Do you wake up defeated? Do you wake up thinking about the long journey ahead? Or do you wake up saying, I can make an impact and do something different? That's what I want us to focus on when we think about the whole health. How are you contributing to that as the bottom line for our Tennesseans? There will be a lot of policies that we can impact. There can be a lot of people that we can impact and a lot of processes that we can impact to drive things forward. So I'm excited to be here this morning. I'm excited for everyone to dive into these conversations to make an impact. And I hope that you guys will take full advantage of what's in store today and continue to do all you can to drive the conversation forward and make Tennessee a healthier place. Okay.
Thank you so much for those comments and a really great capturing of our vision and the idea for today. So really appreciate that. I want to draw on what you talked about. Partnerships are so important. Can you talk a little bit more specifically about what Wellpoint is doing, particularly in this whole health idea about moving your organization forward to ensure access to these services?
Sure thing. So I'm newer to Tennessee. I'm a down south girl. I was raised in Alabama, but I took on responsibility for Tennessee about 1.5 years ago. And what I first realized is that Wellpoint had a lot of programs, but we actually didn't have a lot of members taking advantage of those programs. So we had to work on a new strategy to actually identify anchor partners. So when I think about anchor partners, those are the CBOs in the community that are trusted. These are the organizations that your members go to when they don't trust you. A lot of times in healthcare, people won't share a lot because there may be consequences. And so how do you build that trust and still continue to support these communities? So what we did is we implemented a strategy to identify more anchor partners throughout the state. And so these anchor partners are the ones that we had to go to first to build our trust. And then with them, a lot of times we said, hey, well, we will show up with you, but we can be in the background. We can just give volunteers, we can give time, whatever you need. Because even with an anchor partner, these are the communities that trust them, and they are not willing to put their reputation on the line. So what we did for a number of months, we had to work behind the anchor organizations until they started to trust us. And then eventually they allowed us to work beside them. So now we have access to the people we want to serve. And then eventually they allowed us to be in the front. But it's a concerted effort. You know, a lot of people will say, you can do anything for a little bit amount of time, right? But for you to stay consistent, and that's where we are. Organizations who have built trust, and keep in mind, through the pandemic, These are where communities leaned on these organizations. And they built a lot of processes in that time to build that trust, and they're not willing to risk it. So understanding how you can see the value in partnerships with not always having to be in front, but as long as you're making an impact and being able to educate and support those communities, that's your goal.
That's wonderful. And I think, part of the reason you talk a lot about trust, and part of the reason there's a lack of trust among the folks we're trying to serve is because these are about social determinants. They're less about, I have this physical problem. They're sharing something that might be more about their lives there. Can you talk a little bit about what you see as the most significant social determinants and maybe some of the more thorny ones that you deal with in order to get to the whole person health? What are the things that are really needed to tackle those social determinants?
So I think we need to first understand that vulnerability, that's a key driver in health. Before a member will tell a provider about what they're dealing with at home, they have to have trust. A number of times my caseworkers, when they engage with these members who they are really trying to solve for some of the most complex conditions, it takes them months to realize they may be going through a domestic violence situation at home, or that they may not have food for their children, and so they're missing all of these appointments and they can't follow up. So I think understanding the vulnerability and its role in the SDOH and social drivers of health components is important. I also think that within Wellpoint, we've actually partnered recently, and we've identified loneliness as the social driver that people don't talk about. When you feel lonely and defeated, there are a lot of things that come along with that we haven't as a society really put into place to support that structure. And so when I think about vulnerability, when I think about loneliness, those social drivers of health that we don't talk about, another piece is food insecurity. So I worked with a partner who taught me that food insecurity is actually one of the most flexible insecurities of all. If someone is able to eat a candy bar at work, they would say that they had a meal, while the other person was able to eat a full course meal or a meal that has all the necessary food groups. And so we have to think about that entire spectrum of the insecurity within our communities. And then we do know, and one thing I quickly learned when I got to Tennessee, so although we are one state, we are truly 3 states within a state. And then within those grand regions, we also have other states, because you can see a vast difference in the landscapes and in the communities and the resources available to those communities. So when I think about things I want to address, it's the ones that we really don't talk about. So that vulnerability, earning that trust, also speaking to that loneliness component, and solving for a basic necessity, which is sustenance, and ensuring that people have access to the right food so then they can focus on the other things to get them to those healthier outcomes.
Yeah, and you mentioned COVID earlier. Loneliness, of course, we know has been definitely impacted even more in that environment. So, and you're talking about things, when you talk about food insecurity and loneliness, I think even just 15 years ago, we wouldn't have had that conversation in talking about healthcare. We've come a long way in really understanding the impact of those. In addition to sort of the social determinants and the whole health arena, are there other trends that you're seeing in Tennessee healthcare's landscape, the coverage landscape, in terms of your growth strategies or any proven and effective ways that you'd like to tackle maybe some of those other issues that are out there?
Sure thing. I think in Tennessee, we have a large unhoused population, depending on where you're going. I also think transportation is a barrier. So in Tennessee, when it comes to Medicaid, we are one of the most innovative states when it comes to Medicaid. We have free transportation to all of our Medicaid beneficiaries. We now cover dental coverage for our adults in the state. We were amongst the first in the country to do that. And also when it comes to diaper benefit, that is something new that we've rolled out for free diapers for those children under the age of 2. So when we think about innovation, Tennessee is at the forefront, but there is only so much you can do. So although there is a free transportation benefit, depending on where you are in the state, we don't have Uber, we don't have Lyft, so it's very difficult for those transportation companies to ensure that they can solve for that need. So that's when we get into creating those relationships with those CBOs who may have access to transportation to solve those needs, but it comes and starts with a conversation. How you collaborate around the table, how you bring solutions. It is so easy to talk about everything that is going wrong, but when is the last time you actually tried to solve for an issue that's going right? And when we talk about solve everything, you can't fix problems with people, throwing more people at it, but really trying to sit down to hear from the members. So at Wellpoint, what we do is each quarter, I travel throughout the state and I have roundtables. And I bring my senior team leaders to those roundtables. And at those roundtables, I bring legislators, I bring providers, and I also bring CBOs. So we can actually sit and listen from those in those communities, talk about the problems that they're dealing with and how they recommend solving. Wellpoint can't solve it all. This one legislator may not be able to solve it all, but it gives you an opportunity to actually hear from the people who are impacted, those on the ground really trying to make an impact. And I think a lot of times those are the conversations we miss. The people who are engaged and do this work. I talk a lot about our LTSS community. And that's one of our most complex communities. And my leaders within the team in the last year, they have actually gotten out to hear from those members, to hear from those providers, and hear from those who are trying to solve. So it goes beyond the day-to-day and thinking that you have the solution. I can be here giving out food boxes every day until I learn that food boxes actually don't solve the problem of food insecurity. I need to figure out why they don't have access and how I can solve for that. So when you find the leaders in the communities that are already doing the work, when's the last time you've asked them to have a conversation or how you can help? Because maybe your survey isn't the answer. Because as an anchor, they are hearing from the community. They didn't realize that the members are working until 9 o'clock at night, and by the time they get off work, because this is their second or third job, the grocery store is closed. So all they can eat is a Pop-Tart from the vending machine or that soda on the way home. So they don't see themselves as food insecure, but they don't have access to the right things. So have you partnered with your local organizations or community-based hospitals to say, maybe at an appointment, could we have this available to your members? So I think the conversation and collaboration will be critical and key to us driving the things forward here in Tennessee.
So let's dive into that collaboration issue a little bit. You've talked about transportation, you've talked about housing and healthcare, maybe education, maybe aging services. When you host those kinds of conversations, what do you see as the ways to not try to solve it individually, but together? What do you see as the opportunities to collaborate in that?
So I think the first opportunity is actually bringing the people around the table who are already doing the work. So I did have a round table in East Tennessee, and we talked to a number of organizations who were trying to support individuals who are getting back into the job market, who may be food insecure or maybe housing insecure. And one organization talked about how they have to throw out the food because they don't have enough people to get to it. But the person they were sitting at next to the table, 2 seats down, said, well, I'm actually trying to get more food. So hosting and collaborating those sessions. And I think the important part is when one wins, we all win. So as long as we're at the table trying to solve and meet the goal, I personally don't care whose name is on it. When I see the mom who's now able to go to work and sustain the job and her kids are taken care of, then I have a good feeling inside. I know that we've met that outcome. And then to align them to a provider who's focused on the exact same work and quality focus is critical. And so this also goes beyond just the members and the community providers. And our community stakeholders. It's the providers as well. And what you will learn is providers want to do the right thing. But just like everyone else, they're overworked. People made different choices in the pandemic not to come back to work, so they're trying to do it all. So how can we support when we know that there are providers who are trying to do the best they can, but they have limited resources? We talk to them. We try to collaborate. We ask what could take something off their plate and what we can do differently. And I think those are the type of conversations we have to continue to have.
I'm going to expand one more time in terms of thinking about, you've talked a lot about CBOs and sort of service provision. What about sort of the physical environment, the aspects that are outside of service delivery, things like neighborhood safety, pollution, other issues that are out there? Are you having any success, any innovations on some of those more contextual issues and not just the service provision? Any thoughts on that?
Yes, so I think that's all part of your growth and sustainability plan, right? So when we talk about the whole health of the member, it is physical, it is environment. And so what we're doing is a number of our programs, we actually have to send our associates into the homes of members. And they bring that feedback back of what's happening in the homes. So within Wellpoint, we are now delivering a model to support home instability. We are also implementing a workforce development pilot with our members. We want to ensure that if you are doing all the right things and you're making your appointments, but you may not have the best landlord and your heat is off, we want to help you with that. So I think it's about creating the programs that the members say they need to help them sustain their outcomes, but because the physical can be just as impactful as anything else when it comes to our environments with our members. We do have associates who also, these distressed communities, that's where we spend a lot of our volunteer time. Right now in Wellpoint, we have over 600 associates who average, I believe we're at about 17 hours of community service time. So just as much as we may give a check to support an organization, we give our time. And I think that's important. There are a lot of people who can give money, but the most precious thing you have is time. So when you show up, people remember, and that's how you start to gain your trust again.
So speaking of volunteer time, you've focused us also on the workforce that's doing all of this at Wellpoint, at other organizations. When you think about, we've talked across the states, within states, about the workforce challenges that we all face. Our healthcare workforce has been strained for years, and we're trying to bring new people into the healthcare workforce, right? And do you have any advice for those that are thinking about the workforce issues, particularly how we get new professionals involved in the whole health environment for Tennessee?
Well, let's make sure they all don't move here because we can't handle that on our roads. But outside of that, I think we work with our institutions. I was at a conference a few months ago and they talked about everyone who was moving to Nashville for these awesome careers. I said, but we don't talk a lot about our college students staying in Nashville, actually staying in Tennessee. Do they see the value of living here and contributing to the workforce here in Tennessee? We have so many opportunities. You don't have to go to LA and New York and Atlanta or Charlotte to get the opportunities to make an impact to serve. So I actually think we should be working with our local institutions to help drive value in living here in Tennessee. Now, you don't have to stay with your mom, because when my kids graduate, please don't live with me. But when we look at what we can do and make an impact, how many college students are raising their hand to say, yes, I want to work right here in Knoxville or the Tri-Cities or Nashville? We're not having those conversations. Every other city makes it look big and grand. So we need to have the conversations, the same conversations that drove people to move here with our students who are already here. Right now, we have a nursing shortage. That's across the country. We've partnered with some of our local institutions to provide nursing scholarships. And as a part of that nursing scholarship, we have asked that when they stay in the state of Tennessee, they work on one of our distressed counties that the governor has outlined. So we are trying to not only align to living and staying here in Nashville or throughout the state, but focusing on those counties where we need to serve. We need more dentists in some of our rural populations. So we are actually working to give dental scholarships in those rural communities where if people commit to staying in those communities, we fund their schooling. So I think that's how you can help, right? Identify where there's a need, work with those institutions, identify the counties within the state that have the greatest need, and then make your impact there.
I have one last question in terms of thinking about, as I noted in our opener, we bring together industry and providers and foundations as well as state folks. So when you think about, you mentioned education in the communities that you have here, cultivating the workforce and how you might work with them. Are there other things that you look for the state partners, the state agencies to play a role specifically here for you all? What would be the best use? I know we're going to be talking, for example, with the Assistant Commissioner for Disability and Aging. I'm sure loneliness, I'm sure isolation will come up in that environment. Are there things that you would put on the state agenda in terms of policy making that you think are important?
So living around the country and serving, we truly have a healthcare system in Tennessee that supports the work that we want to do. And I don't know if people who've always been in Tennessee really understand the value in that conversation. There has not been one meeting or introduction that I've had that people weren't willing to collaborate. This is from organizations in the community to state organizations, people who hold and can impact political policy. They just want to know the why. So I think bringing people along with you to have that conversation, to ensure that they are invited to the table, it's very easy to say what's not being done when you haven't attempted to have the conversation. And sometimes it's not what you say. We all know it's how you say it. And understanding we have full value on what the focus is. If we know that there have been counties that have already been identified as counties of focus, when's the last time you've been there? Are they on your radar? Or are you focusing on the things that are kind of easy wins, right? So I think when you get the opportunity to meet with your state regulators or those at different state agencies, first of all, please ensure that you're inviting them to the counter. And when you're at that table, ensuring that you ask about their strategy. Allow them to share what they're focused on and then figure out how you can fit in that puzzle. Again, it's about trust. The first time you come to the table, if all you have are negative things to say, and we don't even have a relationship, it's just like any other thing, right? So ensuring that you build trust, because these are the agencies that can impact the people and policies that we serve. And we want to ensure that we have a trusted relationship and we show up and deliver as we say we will do. So I would say, for sure, bring them along, have the conversation, and be open to the change.
That's wonderful. I mentioned when I started that I spent 25 years in Washington, D.C. The only reason I survived that, to be totally honest, was I worked with states. I didn't work with the federal government primarily. I worked with states. And to me, I think that the kind of descriptions you're talking about of building trust, of talking, those things happen only in the local environment, in the state environment, which is why we do State of Reform, is to host those kinds of conversations. I think this is where it's most productive, and I think we get the most work done. So, and by the way, I left DC, so I now live somewhere else. So I really do appreciate your comments and your context setting. It is ideal for today. We look forward to the dialogue and the rest of the sessions. And really, thank you so much for your comments and starting us off in a great way today.
No, it's been a pleasure. Happy to serve.
Thank you so much. We will be adjourning now and heading to our breakout sessions around the corner back by the registration desk, and we'll see you back in here for the lunch session. Thank you so much.